Well, when I was a third year medical student and I was researching different fields of medicine, trying to choose what I wanted to do, I actually went to our own student affairs office and was reading through a number of different descriptions of each field. And I saw that physical medicine and rehab uh, had a very high physician satisfaction rating, which it seemed like it was higher than many of the other fields. When I dug a little bit deeper, I found out that the physicians in our field tend to make very strong bonds with their patients, very close links. So, and for me, that was very appealing. Plus, the other motivation to choose this field was that it really has a lot of things in common with other fields, such as internal medicine, orthopedics, neurology, all other topics that I very much was interested in. So when you look at that put together, that was the reason that I chose the field of PM&R. The rewarding part is that we tend to work with a lot of patients with disabilities, which can either be musculoskeletal disabilities like sports injuries, occupational injuries, or neurologic injuries such as head injury, stroke, spinal cord injury. We work with those patients to get them back to their functional level of improvement. So seeing a patient starting out with a disability, working with them through their troubles, and then finding out that they're reintegrated back into their activities is very satisfying. There's not one specific stereotype as far as applicant or student that we look for our field. It's maybe a little bit different in some other fields in that we really look at the whole person. We look at their interests. We look at what their motivation is relative to the field, uh, uh, and so forth. So we don't look at set board scores. We look at the find out what is the student's background as far as what have they done within the field that has shown that they have a strong interest. So we really look at the whole person. Well, the one good thing about physical medicine and rehabilitation is that there are not what I would call a lot of medical emergencies. There are a few, but not many, which leaves you a lot of time to spend in outside interests, whether it would be with your family, your avocational interests. So the work rules, or the work hours are typically pretty manageable for most physicians in our field. Well, the challenges within our field are, as I mentioned, probably twofold. Number one is at times we do work with patients that do have very, very severe disabilities, so severe spinal cord injuries, severe head injuries, and so forth. Working with those patients can be at times taxing as far as from a psychological standpoint. You're dealing with very, very life-altering injuries for these patients. And also other challenges, which is probably not unique to our field, is the business side of medicine, dealing with the ever-changing insurance industry, how to practice within your own practice relative to the larger fields of medicine. That's becoming, I think, a stressor for all physicians at this point. I think our field is exciting. It's extremely diverse, one of the more diverse fields that you can choose from. Uh, as I mentioned, I think the thing that still sticks with me even to today, after all these years, from what I read in the student affairs office, is that I do think that the physician satisfaction with their jobs is extremely high. It's usually above 95%. So there's probably not too many other fields out there where the physicians are truly engaged in their field and they truly love what they're doing. Uh, so I think for students that choose our field, they're going to be very pleased and be happy that they did so.